Phillip Lee.
Thank you, Mr. Deputy Speaker. The nature of this debate is that one can talk about anything really with regards to the National Health Service, be it local or national, in the context of cost, the estimates of cost. When one looks at the figures on the order paper, it's $1 billion here, 50 billion there. It's we need to start planting some money trees, I think, in this country. The figures are immense and are only set to increase, and we all know this. It's been very interesting to listen to contributions this afternoon from both sides of the House. Everybody accepts that the demands are going up, be it because of ageing, be it because of obesity. 26%, I think, of adults in this country are obese. This is increasing. Ageing, almost 25% of the population by about 2030 will be over 60. And on top of that, medical technology and the advances and the costs thereof. I mean, cancer drugs now can be upwards of £5,000, £6,000, £7,000 per month per patient. With these demands and these costs, and it is inevitable, I think, that it is going to be nigh on impossible to maintain the current service. And I sense, even in this chamber, but certainly outside this chamber, that the public are beginning to realise this. And so I think that I'd like to say a few words about that and then go local with regards to some of the things I've been suggesting in my region. And I suggest region is a key word here, not my constituency. The figures are really quite shocking. I mean, some suggestions of 25% of the NHS budget by 2025 on type 2 diabetes and type 1 diabetes alone. Only this morning a colleague came up to me to tell me that he'd been diagnosed with type 2 diabetes. It is affecting all groups in society. 21% of the population smoke, around 28% of the population, adult population male, drink too much. It's about 20% of women drink too much. Prescriptions in 2009, 886 million prescriptions. Total cost of drugs budget in 2009, the NHS, around about 13-14 billion. It goes up 600 million every year. And in view of the fact that we're getting cleverer, shall I say, in terms of inventing new drugs and new classes of drugs, I suspect that figure will continue to increase, because understandably it is human nature to want the very best drug, and the drug that's going to cure your cancer, the drug that's going to extend your life. And so the figures, whichever way you go, dementia doubling in the next 10 years, the profound health and social care impact of that, the impact upon the economy, because families will have to increasingly spend more time looking after the vulnerable instead of going to work. The ramifications of all of this are immense. And I think actually, and I have detected some of this in the chamber today, not particularly from the Right Honourable Gentleman Member for Charnwood, there does need to be some cross-party agreement on this. I suspect we are going to be arguing over the next 10-15 years about how we pay for healthcare. I've been brave enough to suggest that solely relying upon general taxation funded healthcare in the medium to long term really isn't practical. It's difficult politics. Trust me, I saw my Twitter account explode at that point. But I think it is likely that we're going to have a debate and an argument across the House about that in the future, and that's as it should be. But where we shouldn't disagree, actually, is in certain areas of the way in which healthcare is structured in this country. I think both parties, it's a plague on both houses, the introduction of the market into hospital healthcare, the use of PFI contracts, particularly in the last 10 years, have made it extremely difficult to reconfigure hospitals in certain parts of the country. And I think that is unfortunate. I've also heard that the use of competition law and the introduction of it and the possible implications of it with regards to reconfiguration is also looming large in the National Health Service, and I think the front bench might want to look at that, because I am persuaded, and I have spoken on many occasions about this, that we are going to need fewer acute hospitals in the future, but in return we're going to have more community hospitals in the future. So care, the majority of care, will increasingly be offered closer to home, indeed in the home, but that clever stuff, the life-saving stuff that the BBC is currently broadcasting on a Thursday, that type of treatment, that care, cannot and will not be offered in the number of district general hospitals that we've currently got. Anybody who thinks it can doesn't understand, and I would suggest that it's increasingly becoming good politics to save lives, not good politics to defend the indefensible. And I think members on all sides should reflect upon that. One example from that television series was the head-on collision, if anybody saw it. Nasty accident, 30 minutes north of Addenbrooke's Hospital. And instead of going to the local hospital, which incidentally had recently opened, they didn't go there because it wasn't a hospital that could actually care for them. They actually went 30 minutes down the road and were treated at Addenbrooke's. So here we go, we have a new hospital built in the last few years, and it's already not fit for purpose. I think we should reflect upon that. But reconfiguration is essential, it is necessary, and has been shown, and not least of which the stroke services in London, to save lives, to improve care. And I think that this should be replicated across the country. In my local area, of course I'll give one.
I'm very grateful I'm going to give way, and can I say that I think he's speaking a lot of sense, because I know in Durham we've just specialised our stroke unit in the north of the county, and the results already are showing the benefits of that, even though there's a lot of opposition in parts of the region to it. But does he also think that the way that long-term health should be managed shouldn't necessarily just be by doctors, but things like pharmacists and others can play a key role in that?
Well, I'm pleased this is happening in County Durham. The Honourable Gentleman knows I have some family roots that go back centuries in his part of the world. So I'm pleased their services are improving. I'm not persuaded of the role of pharmacies. I am persuaded of the role of pharmacists. I distinguish the two because I personally think all GP surgeries should be dispensing drugs, and I don't see why the taxpayer should be subsidising pharmacies. It's no surprise to me that Boots was the biggest ever private equity buyout in the history of British industry. But it's not surprising when the taxpayers outside at the front of the door going like this, come in and, you know, get your amoxicillin, but by here you can get your shampoo, your conditioner and your raw jelly. And so I'm not convinced in the longer term about pharmacies. Pharmacists most certainly have a role and should be included in that, community pharmacists checking drugs, particularly in cases where patients have polypharmacy, when they're on a whole multitude of medications. Another pair of eyes is always appropriate. But going back to the reconfiguration, in my locality, we have a number of district general hospitals. Bracknell itself has been historically underserved by acute services ever since it was created in the 90s to late 50s, early 60s. And we've seen a sort of a diminishing sort of service in the area for a variety of reasons under both governments, actually. And it's something that's quite sensitive about. Before I became elected as the Member of Parliament, and I stressed that before, so this is as part of my campaign, I suggested that we needed to close hospitals in the area and consolidate in order to improve the service, improve clinical outcomes. I'm not aware that my result at the election was adversely impacted upon by that. I guess, having worked in the area as a GP for a number of years and looked after 50,000 patients, people maybe trusted what I was saying more, and I recognise that. But what I was trying to argue for was that we could consolidate acute services onto a single site and also improve community hospital services in appropriate locations around the region. And I stress appropriate, because often the problem is that for a variety of legacy reasons, hospitals are invariably in inappropriate locations. They're not often on motorways, They're often on land that was bequeathed before the war. In my part of the world, the Astor family bequeathed the land for Heatherwood. The local farmer outside of Slough bequeathed some land because his daughter was looked after well. So they thought, well, okay, we'll build a hospital in the middle of a farm field, nowhere near the population it seeks to serve. And so we've got this legacy problem. So there is some need to actually close and relocate, and there are some situations in the country where you can enhance current locations. And in my locality, there is this problem with regards to Heatherwood Hospital. And bizarrely, and I must put this on record, and this is something which frustrates me, because this is actually blue on blue. If I was in a defence debate, this would be called friendly fire. The Royal Borough of Windsor and Maidenhead have called for a judicial review on the relocating of a minor injuries unit 3 miles down the road. I mean, can you believe this? 3 miles down the road to Bracknell, which is an urban centre in a better location, away from a place that's opposite the Royal Ascot Racecourse. And they're actually having a judicial review into this, which is going to delay it, it's going to cost money. I find this baffling, bizarre, I could go on, but it is evidence of the problem that I guess all colleagues of both colours in this House will experience of local politics with regards to healthcare and trying to change services for the good, for the improvement of services, for the improvement of clinical outcomes. The improvement of clinical outcomes, not about cost, though obviously that's a factor. This is about improving clinical outcomes. And that frustrates me. I will most certainly be robustly dealing with that in local terms, politically. But I would, just put on record that actually what's in the best interests of the general public at the moment is to have fewer acute hospitals. Of course I'll give.
Thank you, Mr. Speaker. I thank my friend for giving way. He's making a very interesting point. Does he not agree with me, though, that we must be careful in applying solutions such as those that he is espousing, that we don't apply an urban solution to rural areas? Moving an MIU 3 miles may be acceptable, but moving an A&E 30 miles wouldn't be acceptable to a lot of us.
Of course, my honourable friend is right. In a rural location, the distances become further. I don't know his particular situation in that region. I would suggest that there's probably location issues with regards to current hospitals. This is why, and this neatly allows me to move on, why I've called for, and yes, you've heard it here first, a Conservative calling for a Soviet-style central plan, but you actually do need a national plan for acute and emergency care, because by definition, you can't have a market interfering with that. You need to look at it in the round and go, right, well, where would we put these hospitals? Where are the motorways? Where are the population? Where's the population density? Where's the rural location? Where's the urban location? And I think that's required, because the problem is if you reconfigure in isolation, and I've recognised this locally, it has a knock-on effect on other hospital services, who then turn around and say, well, where are we getting our patients from? If there was a national plan in which everybody bought into, both parties, a cross-party committee looking at this, dare I say it, take it out of the sort of political exchanges that we all going to engage. And I fear it's going to be, 2015, we know what's going to happen in certain quarters, and I'm sure my honourable friend is very aware of that, is that it becomes a political football. And I think that is dreadful when it comes to actually saving lives. Let's try and take this out of party politics. We can have robust exchanges on principle about payment, about the way in which you commission services or not, whether you should have top-down reorganisation. We can exchange on all of that. But fundamentally, where hospitals are located, both acute and community hospitals, should really be decided nationally, because of the fact that you end up with potentially perverse decisions where some services die, wither on the vine, and you end up with gaps in the emergency and acute care for the country. So I suppose in conclusion, it is a plea for some cross-party activity on this. The National Health Service's budget, indeed, and let's put this in context, currently we have debts and liabilities in this country in excess of 5 times the size of our economy, and it's getting worse. All right, almost 40% of spending is on health and welfare, and it's getting more and more. And we know this is going to be the case. We've heard this afternoon it's going to be the case. let's be realistic about this. There's only so much we can afford. And I genuinely want a service that is based upon clinical need. I genuinely want somebody to arrive at the appropriate location and get the very best care available. My fear is, if we continue along this path of denying that the service itself and the way in which it is perhaps paid for, but more importantly, structured, we're going to end up with more and more scandals. There are more in the pipeline. I mean, the chief executive has just resigned from Thameside Hospital. We're going to get more and more of this, and I think the public out there want more from us. They want us to make some difficult decisions for sure, but I think they actually want us to take the evidence and use evidence, not party politics. And I make that plea to everybody that if we can do that, we can actually structure a service that then would become the envy of the world. Because it isn't at the moment, become the envy of the world. And I, for one, would think after however long I end up staying in this chamber, if that is achieved in the time that I've been here, I would retire a happy man. Thank you.